So on that topic, I would actually change it a bit and tell you that the ICD-10s now may be getting us into some trouble because companies are starting to downcode our claims, and they're using the ICD-10s. So they're basically saying, you may think that that diagnosis deserves a level 4 code, but we're going to tell you it's only going to be a level 3. So there's a lot of downcoding, what's known as downcoding going on, that people have to be aware of. And it's a very difficult thing to pick up sometimes, because it's easy to tell when someone tells you that they're not paying you for something. You get a 0 on your explanation of benefit. But when someone's paying you less than you're billing for, that's more difficult to pick up. So that's really important for people to be looking for in their EOBs, their explanations of benefits, because it's not that readily visible that you're being paid less than you should be. So in today's world, if you have a scribe and they're not changing the complexity of disease that you're treating, you're going to be downcoding yourself. You need to know which types of diagnoses and what type of words will trigger a change, and that's where the AI scribe comes in, where it actually knows which words change the complexity of the diagnosis. So if you learn the catchphrases that you need to really be aware of to say in the visit, you're going to code at a better efficiency. To open their minds. Don't try and do more and more of the same thing, because you're going to burn out. Think about alternative revenue streams. If you don't know how to do them yourselves, like we talked about buy and bill, hopefully there are going to be companies coming around that will actually be outsourcing that type of process, and you can find a way to capture some more revenue that way. So 2026 is a continuation of just the last decade of revolutionary therapies that we've gotten. I think this year we're probably going to be seeing more kind of an oral revolution. There are going to be more pills coming out to treat diseases that we have traditionally treated with injections. So I think that that's going to be a big trend that we're going to see happening. We're going to start to see companies coming out with drugs that have longer half-lives, meaning that we'll have to give that treatment a couple times a year or even once a year, which is pretty revolutionary, and it's a fun time to be living through.